Good morning, everyone, and welcome to the event with the Inter-American Dialogue. We're going to get started in just a few minutes, so thank you for your patience. Hi, everyone. Thank you again for tuning in to the event with the Inter-American Dialogue. We're going to go ahead and get started. So, Michael, I'll move the floor over to you.
Thank you, Sophia. Good morning to everybody, and good afternoon to our friends and colleagues in Europe. Welcome to a very important and timely session on COVID-19 and human rights in Latin America and the Caribbean. Today's session is part of a series of virtual events the Dialogue is organizing on the wide-ranging effects of coronavirus in Latin America and the Caribbean. We hope you want to stay informed about future sessions by opting into our outreach list on our website at thedialogue.org. We've also published a page dedicated to this subject on our website, thedialogue.org/COVID-19, that is updated daily with relevant and informed analyses regarding the impact of the coronavirus in the Americas. We are truly privileged to be joined today by the United Nations High Commissioner for Human Rights, Michelle Bachelet. High Commissioner Bachelet has said that the COVID-19 crisis poses a, quote, colossal test for leadership. Since the pandemic emerged, she has shown real global leadership as a forceful and tireless advocate for a human rights-based response, calling for universal access to healthcare, global solidarity, and efforts to mitigate the impact on women and vulnerable groups such as migrants, prisoners, and the poor, who are disproportionately affected by the crisis. The High Commissioner has warned of the threat to civil liberties posed by governments that use the COVID-19 emergency as cover to concentrate power or pursue repressive policies. She has cautioned that gender gaps and inequalities worsen when the effects of such crises on women and vulnerable populations are not given the highest priority. As a two-time former president of Chile, first from 2006 to 2010, and then from 2014 to 2018, the country's first female president, former head of UN Women, the former health minister and trained physician with specialization in pediatrics and public health, and, if I might add, the former co-chair of the Inter-American Dialogue, High Commissioner Bachelet has shown an unwavering commitment to human rights, social justice, and democracy. No one is better equipped and more attuned to how COVID-19 is impacting human rights in Latin America and the Caribbean today. I've asked High Commissioner Bachelet to give brief opening remarks for about 10 minutes, which will be followed by a conversation, first with me and then involving all participants who can submit questions on Twitter using our hashtag COVID-19@LatAm or by emailing meetings@thedialogue.org. High Commissioner, we are so grateful to you for taking time to join us today and sharing your perspective on an issue so fundamental to the current crisis. Thank you very much.
Well, thank you very much, Michael. Very happy to be with you, my former house, if I may say, as co-chair of the Inter-American Dialogue. And I really thank you for this hosting this webinar and for inviting me at a time that I think we will remember for the rest of our lives, because we are all aware that COVID-19 pandemic is the most serious health crisis in decades, with severe social and economic impact. It is a human crisis, a challenge to our society, to our governments, to ourselves. And of course, I think it's an enormous test. It's an enormous test of leadership and of humanity as well. So we may be physically distant today, but we must stand together. Overcoming the pandemic demands decisive, coordinated, and innovative action from all and for all. Last week, as you all know, the Secretary General released a report showing how human rights can and must guide COVID-19 response and recovery. And the priority, of course, is to protect human lives, and for the response is to be inclusive, transparent, and accountable. Emergency measures that are helping to contain the spread of the disease and that are necessary should be temporary and proportional, protecting people and the rule of law. And it is vital to ensure that no one is left behind, because the health of everyone depends on that. But while the virus does not discriminate, its impacts do. Pandemic is a risk to us all, but it has disproportionate effects on the health and livelihood of certain people and communities. Some of the most vulnerable in the face of this crisis are those already at risk. Sorry, I'm gonna have a drink of water. The protection of migrants in Latin America, for example, is a source of concern, with reports of deportations, closed borders, and new restrictive legislation. In Guatemala, migrants are returning with no sanitary safeguards in place. This is allergia, not COVID-19, including deportees from the United States who have tested positive to COVID-19 upon return. There are also reports of deportees from Mexico facing increasing stigmatization, with local communities establishing barricades to prevent their return. Indeed, the pandemic is generating a wave of stigma and discrimination worldwide against certain national and ethnic groups, those suspected of having COVID-19, and also against health workers. We need to work together to push back against this trend, which feeds on misinformation and fear. Awareness-raising campaigns and the dissemination of accurate, clear, and evidence-based information are the most effective tool. In fact, access to information, public participation, and inclusive response are essential to the overall efforts. So this is a time when more than ever, government needs to be open and transparent, responsive and accountable to the people they are seeking to protect. In Latin America, social protests for access to basic rights have been met with excessive use of force in some countries. That was the case in Honduras, Colombia, and Venezuela in recent demonstrations against food, water, and medicine shortages, as well as lack of transparency of the situation. My office has also received reports of arrest and detention as form of heavy enforcement of quarantine measures. Let us remember that people deprived of their liberty, including in prisons, are at very high risk of contamination, given physical distancing is difficult to achieve on those places. In El Salvador, there are reported cases of ill treatment and excessive use of force. Many people found in breach of home quarantine were arrested and detained in often overcrowded conditions for extended periods, ignoring repeated rulings of the Supreme Court against such measures. Similar proceeding has also been seen in other countries of the region, with over 11,000 arrested or detained in Guatemala, 35,000 in Dominican Republic, and 50,000 in Peru. Although all of these are concerning trends, we are also seeing positive measures being put in place in the region. In Peru, the Supreme Court has called on judges to use pretrial detention only in exceptional circumstances. Mexico has adopted a law allowing the early release of prisoners. And following advocacy from my office in Bolivia and Chile, both countries are cooperating of the entries of nationals to Bolivia. And we will continue working with partners in the region to support human rights-based efforts to address the crisis. But as one of the specific issues is that, of course, COVID-19 pandemic also represents a high risk to women and girls, not due to any inherent vulnerability, but rather to pre-existing discrimination and inequality. As a matter of fact, women can get infected as men, but the death toll are higher in men than in women. So it's not that women have an inherent vulnerability to it. It's more because of the lack of good conditions for women in the region. In the world as well. In Latin America, this is particularly evident for women working in the informal sector, domestic workers, indigenous, Afro-descendant, women with disabilities, migrants, women living with HIV, and those of diverse sexual orientation and gender identity. So to better protect all, the response to COVID-19 should consider gender-specific experiences and needs. Like in past health emergencies, the current crisis has been accompanied by a surge in gender-based violence. This has been increasingly reported around the world, especially in places where quarantines, self-isolation, and other restrictive measures have been adopted. For victims, access to support can be difficult due to confinement with the abuser, or because such services also risk becoming less available. And the situation is not different in Latin America, a region where the levels of gender-based violence, including femicides, are among the highest in the world. And my office has received concerning reports. In Brazil, the Rio de Janeiro Public Defender for Women's Rights indicated that cases of domestic violence has increased by 50% during this isolated and confinement period. In the Buenos Aires province in Argentina, calls to a support hotline have increased by 60% since the quarantine started. In Peru, women emergency centers and hotlines are working with limited capacity, leaving many cases unattended. To address the issue, support services should be declared essential and remain open. Accessible systems to alert authorities and protect victims should be put in place, and victims should be informed about available services. It is encouraging to see some important measures already being taken. In Argentina, a government campaign allows women to seek rescue in pharmacies, including over the phone using a particular code. That way they say that they're in danger so they can be rescued. In Costa Rica, a government-led informative campaign, which has the support of my office, is telling every woman, hashtag no estás sola, or hashtag you're not alone. So I welcome this example among many others. So dear friends, the full impact of COVID on global and national economies has just to be felt. But according to a recent report by the Economic Commission for Latin America and the Caribbean, ECLAC, the pandemic will lead to the biggest contraction in economic activity in the history of the region, a minus 5.3% drop in 2020. And this situation will impact all, of course, but once again, women will be especially affected. In most Latin American countries, women are highly concentrated in the low-wage and informal sectors. Among almost 40% of the women working in the region are employed in areas that have been really affected, like tourism, commerce, restaurant, hotels, and domestic work. In Bolivia, Guatemala, and Peru, for example, 83% of women are employed in the informal sector with no social protection. Indigenous women are disproportionately represented as well in the informal economy, so their access to livelihoods is at risk and the threat of hunger becoming very real. In addition, they face barrier to access healthcare and information. Living in rural areas, many indigenous and Afro-descendant women have no access to internet, electricity, or public transportation. And all of this, of course, is higher when you have lockdowns. My office has also received reports about the limited availability of health-related information in indigenous languages. So this situation is particularly affecting as well older women. Moreover, women in Latin America perform 73% of unpaid care work. With schools closed, they're under additional stress, with risk for their health and well-being. In the region, they also represent half of medical personnel and more than 86% of nurses, the highest percentage in the world. As caretakers at home and hospitals, women are disproportionately at risk of infection. Furthermore, overloaded health systems, reallocation of resources, and shortages of medical items could undermine the sexual and reproductive health and rights of women and girls. For example, I have received reports from Honduras on the negative impact of the pandemic on prenatal and postnatal care. In Guatemala, indigenous midwives who play a crucial role in their communities lack basic products to combat COVID-19, including alcohol, gel, and soap. Friends, although the challenges posed by COVID-19 in Latin America are indeed grave, we also see several promising practices coming from the region. For example, to address the economic impact of the pandemic, the authorities in Costa Rica have taken measures to protect labor rights of women and reduce credits obligation for projects including youth, women, indigenous, Afro-descendants, peasants, migrants, all the people, and those with disability. And I have to say, one of the things that we see in human rights in all over the world, and including here, is the intersectionality of many of these things. You have women that are indigenous, that are old, or migrants, or refugees, and or Afro-descent, or HIV, and some of them have all those factors in common and are much more vulnerable as well. In Bolivia, the government granted special leave permits to protect salaries of certain groups, including pregnant women and single parents with children under 5 years old. My office is supporting several response efforts in different countries in the region. Some examples included like providing technical support to civil society organizations and state institutions that work for the legal defense of women deprived of liberty in El Salvador. Working with the Indigenous Authority and women's organization in coordination with the government to facilitate access to healthcare information in Panama, and launching the social media campaign #Mujeres y COVID-19 in Guatemala, which provides a platform to women experts, activists, and others to voice their reflections and concerns. Unfortunately, like in other parts of the world, women and their organizations are not equally represented in the design of COVID-19 response. The majority of the task force are really heavily male-dominated all over the world, and Latin America is not an exception. So states may take specific measures. That's why the Secretary General has developed a guidance, special guidance, that we give a lot of recommendations on how to really pay attention to the most vulnerable group, but also on women. And soon we're going to develop what I launched the guidance of elder people and on people living with disabilities, as we already did with people in prisons and on migrants. So state must take specific measures to ensure that the rights of all women and girls are protected during the crisis, because of course everybody's rights needs to be protected. But we have been discussing that the virus does not discriminate, but the impacts do, and that women and girls are disproportionately affected. My office, as I said, has issued guidelines in this regard, including, for example, to ensure that women health workers have adequate access to personal protective equipment and that medical care is available and accessible by all women, including sexual and reproductive sexual services, health services. To promote equal caregiving responsibility, or to declare services related to gender-based violence as essential, as I mentioned before. It's a lot of recommendation on the different aspects that we have identified. We have also stressed the critical importance of gender-sensitive economic incentives and social safety nets that should reach and empower every woman and every girl, given the high levels of informal sector, the presence of women in the formal economy, the important also on the SMEs. So the government needs to think on particular in the fiscal packages, to think particularly on women's issues. And I say this, Michael, because when I was president, and first time, and I had to deal with a crisis at the end of the 90s, was it? And we did one fiscal stimulus package that in the economists, they said was like the fifth best in the world. But when I look at it, there was no gender lens. Everything, there was a great, but it was not thought that women also are losing jobs. So we need to be sure. And then, of course, we made the corrections, but it was done by male mainly. So they did not have the gender needs included. And that's why we are stressing the critical importance of that. So, dear friends, the pandemic is exposing, I think, the damaging impact of inequality in every society. Let us be clear, gender equality is not an option, nor can it be cast aside in times of crisis. It is essential to peaceful, just, and resilient societies as recognized by the 2030 Agenda for Sustainable Development. But also, I have to say this, countries who have women leaders have done so good on the response of the pandemic. They have shown they're decisive, they do fast decisions, they do everything, they have a call of action, they don't fall in denial, they assume, and they also have a very important style of leadership, communicate better, they're compassionate, but they're also decisive. So that shows that it's a real prejudice that's a male attribute. I mean, female leaders have shown great results. And I think it's important because even though we see the pandemic in the short term very difficult, and we don't know how long we're going to be with it, probably until the vaccine works, I hope that this teaches us to look at the world in a different way, to see what is relevant, to think on humankind in a different way, to look at the political system and the economic system that can be real sustainable, to understand the importance of climate action and respecting biodiversity, because many of the last huge pandemics, SARS, MERS, COVID-19, and the porcine flu and others, are zoonoses. So there are some of them wild to domestic animals and then to human beings, others from animals to human beings. So we need to take care as well on all of these elements. So I also hope that this is an opportunity to acknowledge the contribution of women in the world and to give them not only to applaud them at 8 or 9 o'clock because as health workers, but to give them the opportunities and rights they deserve. So I think that to finalize that we should consider that gender equality is important. Ignoring this will not only be counterproductive, but unprincipled, betraying the fundamental promises that every country has made to its people. But when we overcome the pandemic, as we will, we must seize the opportunity of a lifetime to build back better. And I'm confident that it's possible if we are mindful of our interdependence, of our equality, of our equal rights. I think if we're mindful that these are global challenges that need all of us, and that's why the world needs to work together in a collaborative and cooperative way, in a coordinated way as well. I think this shows us the importance of multilateral institutions that have to deal with global challenges in a global way. And I think that that's why it's so important also to ensure equalities and equal rights. And the United Nations, my office, and are counting on you. Thank you so much, Mike.
Thank you so much, High Commissioner, and we really applaud your and your office's efforts at this critical moment, which are very impressive. And so, congratulations on all the wonderful work that you're doing on this critical issue. I just want to maybe ask a couple of questions, and then I see we're getting some from our participants. But just picking up maybe on the last point that you made about multilateralism and the importance of it. Specifically in Latin America, do you see any effort to try to share best practices among the countries and different governments? Is that happening, or is it simply, do you see each government basically making its own decisions and using its own criteria, reflecting its particular realities? Or is there an effort to perhaps spur more of a regional multilateral effort in Latin America?
Well, to be honest, I'm not there physically, so I don't know if there's more than I don't see from the distance. But first I have to say, unfortunately, in the world, this has not happened. In the world, there has not been no coordinated action. Everyone has seen by itself. And I understand every authority, of course, has the principal responsibility of saving the life of their people. But instead of sometimes when other countries were not so impacted, but Italy was really impacted, and Ursula von der Leyen mentioned that in the European Commission, is when countries should have said, Italy, how we help you? Do you have enough equipment, etc.? I mean, everybody started trying to see how they buy their own ventilators, how they ensure the PPE and so on. And the problem is that works when it's different when you have the economic crisis at the end of the 90s, because it was a crisis that did not affect at the same time everywhere. So you could think on solutions differently. But when you have a crisis that even though starts in one place, but then spreads so easily to everywhere, you need to think in coordinated ways. You need to look at regionally. For example, now some countries are looking on opening their economies, opening the borders. But of course, I can imagine, I live here in Switzerland, that and Switzerland, have with Italy, with France, with Germany borders. So I imagine that it couldn't be that Switzerland opened its border, but France doesn't, or Germany doesn't. So just given, but and because in Latin America and the Caribbean is started later, I haven't seen yet important coordinated efforts. Probably, I mean, there was, I think in January or February, there was a meeting here in WHO for the Ministry of Health on COVID-19 response. And a lot of ministers or undersecretaries came there. I saw some of them. And of course, they sort of look at the ways to respond. But if you see the response, it's been completely different from one country and others. Mm-hmm. Some have locked down everything. Some have locked down partially, gradually. Some are testing, some are not testing. Some are tracing contacts. I mean, everybody's doing something, but I mean, the capacity to respond of the health system is very different. And I haven't seen yet this so important, I would say, coordinated thing. What I've seen though, is on the economic analysis and response, is that ECLAC is doing a big effort on trying to identify this problem and work with governments. And of course, PAHO is of course doing a big effort on trying to coordinate this kind of responses and to provide the necessary equipment to some. But to be honest, these have shown that even though the majority of the countries of Latin America are still talking about the importance of dealing with global challenges in a global way and a coordinated way, we're still not there, if I may say. We need to do much more to create this sensation. And in the past, we did so much because when I was Minister of Health, for example, and we had epidemics, we worked with the epidemiologists of the other countries to find common solutions. We work with trying to think how we buy drugs together and medicines so we can have better prices. So probably some of these things are still there, but I have the impression that because it's also a very political sensitive issue, it's not there yet, because we have seen big countries in the region that at the beginning they said there was no problem, that there was nothing that's going to happen, and even government presidents going out in demonstrations, embracing people, and so on. So really, we haven't had a I would say coherent, coordinated response.
Great,
but Latin America is not an exception, unfortunately. Yeah?
Right. Thank you. Well, hope that changes because I think it's important. Just again, trying to put Latin America in the global perspective because you're looking at the whole world. You know, are there characteristics that really stand out, like women, like the informal economy in Latin America is so huge, and women are disproportionately part of the informal economy. Is that and violence. You mentioned domestic violence, and the reports that we're hearing about the increases of domestic violence are really alarming and very troubling. But again, Latin America is considered among the most violent regions in the world, just violence generally, different forms of violence. Are there certain sort of features of the region that are particularly salient when looked in the perspective of globally of other regions that really stand out to you?
Well, on COVID, probably we'll have to wait a little bit more to see if there's some particular trends linked to COVID-19 because it started later than in other places. Mm-hmm. And some of these features are, I would say, shared by other countries. I mean, you go to Asia or to Africa, I mean, the female participation in the informal economy is huge. But on violence, I think what happens also that it's linked to other kind of experiences of violence that went completely with impunity. So at the end, there is a culture of violence in the society when perpetrators of violence, being it politically, being narco, being maras, and so on, are not held accountable. Violence started being part of the culture, and then you see more violence against women as well. Domestic violence, but also abuse and violence. So that's why we have been saying that been recommended national responses plan, for example, in terms of the informal economy, because on the other hand, women are really part of the informal economy for many reasons, but one of them is lack of access to, comparatively to education, to high level education, because one of the other problems with women, and for example, we're telling people stay at home, work from remote, but many times women are disproportionately have less sophisticated workplaces. They work in more sort of, places where you cannot work from remote, huh? And we have seen it in the US as well, but also on other minorities and Afro descent and Latinos, and that be more affected also with death tolls than others. So that's why we are saying, okay, let's think in a national response how we support those women in the formal sector. First with social protection, because they don't have access to social protection, or with put cash in women's hands. So we can support them so they can with cash transfers programs that or using like mobile banking, that those programs that exist but should be expanded in some places, or introduce measures that can either be implemented with low transition cost, such as temporarily eliminating electricity bills for poor consumers, for example, or use pre-existing national social protection programs and adapt targeting methodologies to ensure income for groups affected by COVID-19, and particularly women who are heavily represented, as I said, in those areas that have been touched dramatically, like tourism, teaching, retail, restaurants, hospitality. And of course, to extend basic social protection to informal workers, introduce measures to alleviate the tax burden in women-owned businesses, use women networks and civil society organizations, including microfinance and saving groups, to communicate on benefits, for example, or integrate the gender assessment in all country assessment to understand better the impact of COVID-19 on women and girls, including economic impact and how to address effectively. I mentioned the economic impact because some people believe that the area that will affect more the women's rights is not the health crisis. Of course, the health crisis will have the dimension that will have, the lockdowns will have the dimension we're talking about, but the economic crisis, I mean, in other countries of the world, in Ebola, for example, it was seen that the informal sector took longer, and some places to recover than other sectors. So, and women are related, the places where more women work, while the work in other pandemic has been the more difficult to recover. So any government needs to think how you're going to ensure women's, with gender lens, the recovery, not only the response, but the recovery. And the other concern that I have on the region, but not only on the region, is that for many of these reasons, because the agricultural sector will be affected as well, there is a huge risk of food insecurity on famine worldwide, but of course also in Latin America. So we need also to think on that, how we ensure we support peasants and we support the agricultural sector as well to ensure that there will be enough food for everyone. And the other last thing is, of course, access to water, because we're telling people wash your hand is the more effective way of protecting yourself and your loving people. And many people don't have access to clean water. So there's so many big things and small things that we can do to respond to these issues on women that are still in Latin America. Poverty has the face of a woman, of a child, and we need to deal with those issues.
Great, thank you so much. That's terrific, Commissioner. I have other questions, but I see we're getting a lot of questions in from our participants, so I want to turn to them, to our audience. And as a reminder, listeners can submit questions on Twitter using our hashtag COVID-19 and LATAM, or by emailing us at meetings@thedialogue.org. Let me ask a question that I think won't surprise you, that is about the situation in Venezuela, which I think is you wrote a very, very strong and your office, a very strong and influential report on that country last July. In response to your findings, the UN created an independent fact-finding body on Venezuela. Can you update us on the work of that body and whether you think human rights violations that were outlined in your report have been addressed in any way? And related to that, there's another question: is it time for the UN to take a more central role in working on overcoming the political crisis in Venezuela, and to get more involved in trying to shape a constructive political outcome in that country?
Well, Well, you know what, there's been two things there. On one hand, since some time in the Human Rights Council, they have given us have been resolutions that we should produce oral reports or written reports on the situation of independently on COVID-19 on Venezuela at the same time. And so we started working. I went to visit last year. We sent first a group there to identify the kind of activities that will be interesting, so I can be able to speak with everyone, with different groups. And I had that opportunity really to speak with pro-governmental forces, but also people from the opposition, families of victims of human rights violations, et cetera, and we decided to work on an MOU, a memorandum of understanding, that will permit us to have a couple of colleagues of us working in the resident coordinator's office to be able, on one hand, to provide technical cooperation to the government on some areas that they focus interest in, but on the other hand, to be able to be close to the people, the families, et cetera, and be able to raise with the government's issues that we could have been highlighted to us on human rights violations. And we have a couple of colleagues there, 3 colleagues there working now in the Office of the Resident Coordinators, and they are maintaining a permanent relationship on one hand with the government, to giving some technical cooperation on, for example, the UPR, the Universal Periodic Review, how to produce it, they have asked her for some assessment on prisons, not the federal prisons, but because they have 2 kinds of prisons, the federal prisons, but also they have this small sort of police places with jails, if I may say, that are in the charge of the municipalities with overcrowded and very bad conditions. So they ask us for an assessment and recommendation. They ask us for a recommendation on how the prevention mechanism on torture was working, and we did give us assessment and give recommendations on that, and so on. So we have been working in some areas that the government has been looking after to improve. But on the other hand, we also have been able to enter to the prisons, even the military prisons, even in Ramo Verde, our people was able to be there and to conduct interviews with the prisoners, to talk about the situation, what they have lived, et cetera. But also we have given to the government list of people who should be released. And we of course ask the government to release prisoners on COVID-19 because of the higher risk of spread of virus in jails and prisons, and the difficulties, of course, of maintaining social distancing on them. And we have also been working every time we have identified a problem, like a journalist has been detained or a child has been detained. We have raised that issue with the government, or we have been asking for the release of parliamentarians that are in detention, and so on. So we have been working with them. On the other hand, the Human Rights Council may make a decision to create an independent fact-finding mission on Venezuela. They are working from Panama City, and they will represent the report next September of the Human Rights Council, if there is a session, because we don't know when we're going to be able to have big events. And so we have been providing secretariat support to the fact-finding mission. But I want to stress that they, of course, they are independent than the office, and we are continuing doing our work in Venezuela, and the fact-finding mission is doing their job. So we are working on this, and I hope that we can continue, if I was progressing, to work in some of the most pressing human rights issues, as well as supporting the work of human rights organizations and other UN agencies at the ground.
Great, thank you. Another question asked whether you could speak a little bit more about programs like that in Costa Rica, inclusionary programs for LGBTQ, migrants, and women with HIV. Which countries could especially benefit from this? And also, how do you see the role of civil society to fill this gap if the governments are not able to?
Well, I don't have huge information on the programs. I went to Costa Rica last year or beginning of this year, and we work and talk with the president, the parliament, and the political parties on many of these issues on how to continue advancing on human rights. And I think they have done a lot of things. Of course, civil society still feels that it's not enough because their role is to show what the areas are of major concern on LGBTI rights, on women's rights. But of course, there has been advances. Not all, also, the government, the justice, and they have ombudswoman and so on. But of course, in this concrete COVID response, they had a response trying to identify which were the most vulnerable groups and try to identify access to health, subsidies to support on all these particular groups. Not all countries have done that. Some countries have established some social protection measures, or they have strengthened social protection measures that they had before. But some countries, particularly the LGBTI area, are not doing much, and they are not speaking. Because I believe leaders of the world need to speak out against hate speech, against xenophobia, and against anti-migrant, against anti-Islamic and anti-Semitic, and leaders should lead by example, and they should they should stand up against all that, because otherwise, when leaders don't do that, or when they do comments that can increase the xenophobia or the hate speech, is really not helping the society to be a more inclusive society and a more, if I may say, where everybody feels represented and leaving no one behind. I think it's essential, the role of civil society, human rights defenders, in all the different aspects, women's rights defenders, indigenous rights defenders, land rights defense, environmental. You know that Latin America is the only region of the world that has an agreement, the Escazú agreement that was signed in Costa Rica, that includes the protection of human rights defenders. It's the only one, and with ECLA we did the launching in Spain in the COP in December, and we're trying to show other countries of Africa and other places that agreements of this kind can include the protection of environmental human rights defenders. And I think it's essential by many reasons, not only because it's the right thing to do, because we understand that the COVID response needs to be a big participation of all stakeholders, including, of course, civil society, but also because the response to the COVID-19 needs the engagement of communities. And civil society are embedded in communities. And people need information, transparent information, clear information of what needs to be done, the risk, etc., so they can be responsible and they can respond in the best way to the measures that governments have taken. If it's a lockdown, people, or a curfew, if they understand really why that is needed, they can respond to it. Of course, government needs not abuse of those special measures. They need to be proportional to the need. They need to be time bounded. So everybody knows, well, okay, this will last this time, but then it will finish when things are over and things are better. But I think for all points of view, also because we were discussing that usually when only men respond to this kind of things, they not take into consideration the needs and concerns of women. So women rights defenders or women's civil society organizations can be very useful. And I look at, and government should not look at us as a threat. And sometimes, of course, civil society is gonna complain, is gonna criticize you. Of course, it's their role, but they can also be very effective on one hand, on telling you what is lacking, because sometimes, you know, from the highest sphere, you don't see what's happening in the ground if you don't go to the ground. I try to go to the ground every time, but I mean, sometimes you cannot be everywhere. So they can bring you perspective, insight that you don't know, and that makes your policies being better. But on the other hand, they can be there in the ground working with the people every day, and they can help. Not probably when there is quarantine, but there are other ways. And we're also helping civil society in some parts of the world with technology, even with cell phones, so they can continue doing their work. So I think civil society is essential. We need to help them, we need to protect them. And the other thing I think is essential is the freedom of press, and that journalists should not be punished or they shouldn't be reprisals because they are being critics to the government's response, or because they're saying things like there's no enough PPE or protection for health workers and so on, because it's a public interest as well to know what things are working well and what are not and why. And I think everybody needs, particularly when we're living a time of uncertainties, and for many people fear, to know the truth and to know what's going on and to know the real data, to ensure that and to ensure that and to be also confident if governments are doing things well.
Great, thank you. There's another question, if I just could add, about the role of the private sector in this crisis. If there are opportunities to partner to address the vulnerabilities and to improve the human rights situation, what can the private sector do?
Well, yesterday I had a meeting with Global Compact, of the UN Global Compact on Business and Human Rights, and today I have a meeting with the International Organization of Employees, that they are working on business and human rights. You know, there is this UN guideline principles on business and human rights, and there has been a lot of interest of businesses to understand that if they respect human rights, it's not only they're doing the right thing, but also the smart thing, because that permits them to avoid reputational risk as well, if they do the right thing. So we have been working with them in terms of, and they are doing their own job as well, in terms of how, I mean, they realize, of course, we are here dealing with inequalities, and we have responsibility on our workers. So we need to ensure the health and the safety of the workers. We need to see how our workers, in the cases that they are laid off or they have to closures of some companies because of the lockdowns and others, how to ensure social protection, or in some places subsidies. Of course, there are places like many of these where women are leaders, that they have maintained salaries, for example. Or here in Switzerland, I was talking, and it's more difficult for Latin America, but here in Switzerland, for example, small shops that had to close, the state maintained 80% of the salary, or in France, it's 50% of salary. So, but in other places, you cannot give them a salary, you can give them some subventions or some social protection benefit, or in some places they give us the canasta familiar, package of family with food. Other than what we are doing in the humanitarian aspect on the UN, that is providing food for some places, and including soap, because something that looks so like we take for granted, we don't take for granted. So, but also companies have been doing big and small things. For example, talking to the CEO yesterday of Natura, he was saying that they identified the need of soap, and they are increased the production of soap, and they have given lots of millions of donations of soap to vulnerable countries as well. And also today we were reminding that this Swedish, I think, company, H&M, I mean, because many of the companies, they have asked for products to the suppliers chain, but when this conflict started, they suspended that. But many of them have maintained them, so the supply chain can continue working and delivering those products. So if I would say there are very good practices trying to ensure the welfare of the workers, and they're also trying to identify essential work and their health and safety, but also they are very clear on the importance of the participation of all stakeholders. They are very clear on the importance as well of this tripartite participation, that is states, governments, private sector, and trade unions. Because sometimes you have an economic crisis that won't be easy to recover, but then you can sit together also with big trade unions and say, okay, how we deal with this, how we try to protect as much, but also how we deal with that. So governments and private sector and trade unions can also work on that, but also with others. And I think there are very good experiences going on, as many companies still not doing that. But I think they are more conscious and more conscious. And the other interesting thing that some of them said, look, we all agree that the world will not be the same when we come back. And we all agree that we need the economy to continue recovering and growing, but we need to do it in a better way. We need to do it respecting much more the working conditions, the labor conditions of the people. We need to do it much more with if I would say, a sustainable way in terms of respecting environment and biodiversity, and of course on inclusion of women as well. So I am optimistic that maybe after all of this, I hope so, it doesn't happen that in other cases that people afterwards forget. Michael, if you have asked me during this year and a half that I've been here, many times I thought, okay, if tomorrow, not now on COVID, but before, if tomorrow I will try to bring the Universal Declaration of Human Rights to the General Assembly, probably will not be approved. It looked like we needed the First and the Second World War to sort of identify which were the basic values of living together as human beings that we needed. And that's why the Universal Declaration is so universal. And you know, the commissioners were from all over the world. It was not only Western, as many people say. There were people from India, from China, Latin America, of course, and Western countries as well. Africa, not many, because at that time the majority were still colonies. But the thing is that I hope that something like that can happen to us, that after this pandemic, when we are trying to think how we build better the world, how we shape the world in a better way. Because what will happen, and I will stop there, is that, for example, the majority of our office are working from remote. And so when we come back, and probably in a gradual way, we will have to think what is essential in presence, what can be work remote, what have we identified, is what probably we will not need to fly so much to different places, because we can have access to our colleagues and to other people this way. And I think in terms of technology or innovation, I think we have a lot of things to think very deeply, and in some way how we ensure a more human face to the world. And I'm not trying to be naive, but I really believe this is an opportunity we shouldn't lose.
Great, wonderful, thank you. It's another question about in Latin America, and this is a history you know only too well, that many countries have histories of dictatorships, oppressive governments. Have you seen that these Latin American countries with that history responding to the COVID-19 in a way with certain measures that have violated rights, with curfews and arrests and the like? And also, you were also Minister of Defense in Chile. And so the role of the military is something that's come up as a topic. It came up last year, at the end of last year, with all the social protests, and now it's coming up again with this COVID-19 crisis. Are you concerned about the military playing a role beyond what it should be playing in this crisis?
Well, I have to mention that, as you said, last year in Latin America, we had a lot of protest movements that were calling desperately to address the inequalities on Latin America. And they could, and it was very, I realized very early on this, because also I could see that in all over the world, we have had this kind of protests that were completely different than before. And I will come to the militaries, but let me elaborate a little bit on this, because I've been thinking a lot of this. And you could see that there was like different in the past, because in the past you will have the political parties, the trade unions, the ones who will calling for the process, and this was completely different. It was peer-driven. There was not leader-driven, and it was completely horizontal. It's like some people have called new power versus the old power, and there was young people, not the poorest. A lot of people very well educated or educated, students, of course, women as well, all ages, but mainly young people. And I saw it, and we analyzed last year, there was 80 countries in the world who went through the same kind of process. And also because of probably this interaction of every country, sort of copying certain models. For example, in Chile, when it started trying to avoid paying the subway. And 2 weeks later, I saw in New York in a protest doing the same things, the students. So there are things that they learn from each other, and so what I'm saying that is because we have a continent, a region where there is highly unequal. And those things, I mean, and the COVID has also shown the same, and it needs to be addressed by the governments. I mean, it's not that we will solve the COVID-19 and then we go back to the same inequalities of the past. I mean, if somebody wants to do that, people won't accept that, won't tolerate that. So I think governments need to think very much, as private sector, I mentioned, they have to think how they're going to recover. Government has to think how they include all these different factors in the recovery. But going to the militaries, maybe you won't like my answer, Michael, because I remember that I was Minister of Defense, I was Minister of Health, and I was President of the Republic.
Right.
So there's no problem of the military being part of the response if the roles are clear. The problem is when you use them as police forces, because they're not prepared for police forces. They are prepared for the war. So the tactics and the mechanisms they use are different. So the problem in the protest is when you use them to try to avoid their protest or to ensure a curfew in a way that did not respect certain parameters. But I have had, as Minister of Defense and as President, very good experience on militaries working together, and of course, under the political and civilian, responsibility in providing what they are good at. And they're very good at logistic, planning, support on humanitarian actions. And for example, when we had huge fires a couple of years ago in Chile, and I created sort of the governor of the region, one political minister, and the military was in charge of that region, work together, and the militaries, they will distribute food, distribute water, evacuate people in danger with their capacity. So the militaries can be part of the solution, and should be part of the solution, but with clear, if I may say, functions that are defined by the government, and in great coordination with the government at the national, regional, local level, and with clear functions. So for example, with these military hospitals that can be put in every place. So I have to tell you, when the government has the political power and defines this, it can be very positive. If it's not possible, and it should not be, and the military should not be politicized as well, that could be a danger. A danger is, I guess, and I think, when you use it in tasks that are not the tasks for the armed forces. I will never put the militaries on the streets for issues that should be done by the police, because I think there the danger is that you will have lives lost, and or other kinds of dangers and harms that are not, because they are not prepared for that. They're not prepared for security issues in the streets and in the cities. They're prepared for something different. So, but on these specific issues, if it's clear the functions, and if it's well coordinated with the political level and the municipalities and so on, it can be very useful.
Great. Thank you. Hi, Commissioner. We have time for one more question. I don't want to abuse your time, but really, this has been extremely interesting. Can you tell us? There's a question, I think, from Brazil, from somebody in Brazil, that says Latin American countries are facing today political turbulence. In Brazil, the health minister was fired in the middle of this pandemic, and the justice minister just resigned. How is it possible to tackle COVID-19 and inequalities that you've outlined in this very uncertain and turbulent political scenario in the region?
Well, of course, it's more important if you have a stable, stable situation in a country. And in many countries, even in my own, there has been sort of a commitment of the opposition with the government to say, look, the COVID-19 pandemic is a huge risk for everyone. We all need to work together. Of course, that doesn't mean that you always agree with the government, and you can criticize things that you think they can be criticized. But I think there should be a conversation in terms of how we all push together to deal with this terrible threat. But for that, you don't not need an opposition that is willing to compromise because of a higher interest. You also need a government that really open the spaces to the opposition and really open the spaces to listen of what they have to say, or a government who really listen to the mayors, what they have to say, or to the medical associations or the academy, the universities. But sometimes what you see is that even though everyone and the advisors said something, the government do something different. And not necessarily the best. So if you really want something united, you have to have the enable conditions that is real and not a fiction. To show everybody's working together, but not really working together. Because if you invite to work together and you don't listen to them, that won't help. So it's much more difficult in the scenario that you're mentioning. If there has been a minister of health that have been fired or resigned, or other ministers that have been resigning, of course, it's not the best scenario. And particularly in a country where it took some time until they really acknowledged the risk of the pandemic, because at the beginning was not acknowledged, it was denied. And there were some, from leaders of the country, some, if I may say, images that were not positive, because when everybody was talking about social distancing, you have to lead by example. So it's not easy. And I only hope that there can be a serious conversation among all stakeholders to say, look, this is huge. I have seen Brazil has increased importantly. I don't have the last numbers, but some days ago, importantly, the cases of infected people. I mean, I don't know how many have been tested. You know, with COVID-19, we'll never know how many people will be really infected, because not everyone has been tested. So maybe death tolls are not that high if you would consider all the people who have been ill, and or that had the asymptomatic COVID. But I think on this kind of situation, one needs everyone to sit together and say, look, if we don't push all together, but as I said, really, not only from the mouth outside, really, if we don't push together, we are going to lose this battle, or we're going to have a lot of losses in this battle. And they already have a lot of death. And I think, and of course, and the other thing I would say is that in all parts of the world, even in the most powerful countries, we have seen that no one was prepared. I mean, very few countries, maybe Germany, because they have a more sort of a welfare system. The health system were not well prepared. And in Latin America, it's not different. And there was all this discussion for so many years that the health seen as a cost and not as an investment. And hopefully on the last years, I think there has been more clarity on human capital as the more important capital. I mean, people as the most important thing in every country, and the investing in education and health is essential. So I hope also after all this pandemic, also in Latin America, they realize that investing in health is so necessary, because inequality of access to health is one of the biggest inequalities in our region.
Great, thank you very much. Thank you, High Commissioner Bachelet, once again for taking time to engage in this important conversation. I also want to thank you for your outstanding global leadership, and everybody on this call certainly appreciates your particular impressive expertise and background in Chile and in Latin America. I share your hope that this will be a great opportunity. You made the comparison between the end of World War II. Hopefully this will usher in some really fundamental changes that we've been talking about for a long time, but this crisis may spur a lot of people into action. I also want to go back to your remark, if I could, that women leaders have done particularly well in dealing with this pandemic, which I think is certainly true. And right now, there are no women leaders or heads of state in Latin America. There are some in the Caribbean. I certainly hope that changes soon. So I certainly share your view on that. I want to thank your excellent team for their cooperation, as well as my colleagues at the Dialogue, Sofia Lalinde, Irene Stefania, Michael Camilleri, and Catherine Christie. And thanks to all participants who tuned in and submitted questions. We hope you will join us at our next event of the COVID-19 series. Once again, to be sure to visit our new webpage at thedialogue.org/COVID-19 for our updates. Most of all, please, all of you, stay well and stay healthy and take very good care. Thank you.
Thank you. Keep safe. Thank you.